And so they probably called you that they had to give her some blood products the night before the bronch. Did they tell you that?
So I had got a call about 2:30 in the morning, and they had just asked me. I don't know. It was kind of weird, but they just asked me if she had ever mentioned anything about like her vision, and that's when they said about the benign tumor in her brain. So,
Yeah.
I mean, it was weird. It was at that time, and they just asked me, and she was like, "Okay, well, basically, I gotta go." And so I was like, "What?"
Yeah. So.
And I had no idea that she had that.
I see.
So that was news to me. And then I think they called me back at like 4 or 5 a.m., but I didn't hear it.
Okay, so that night she actually did take a little bit of a turn. That was a little bit scary at the time. She's past that point now, but they called you because she started bleeding. And a lot of times when your body is in a state of shock, your liver can almost shut down, and it causes you to go into a state where your blood doesn't clot correctly. And so she started bleeding, and they had to give her some blood products.
Bleeding like from somewhere? Or
honestly, a lot of her line sites, like every IV that she had just kind of started like leaking blood.
Oh my gosh.
Yeah, it can be a very serious situation. And when they looked at her eyes were doing some weird things, and so they were worried about possibly a bleed happening in her brain. And so they did that CT scan and did not see a bleed, which is great, but they did see that mass. And apparently she'd had it checked out before.
Like 2021, I believe.
Yeah, and so they hooked up this EEG monitor, that cap on her head right now, just to make sure that with that mass and everything that's going on with her body that she wasn't having like undetectable seizures. And so that's what that's measuring, just the electrical activity in her brain. We wanted to be better safe than sorry with everything that was going on with her body, make sure that she was not having seizures.
Was she making any weird movements?
She wasn't jerking, but she would get real stiff like this, and her eyes would kind of roll back in her head. And it could be because we were trying, sometimes some of the sedation medication can make you have some effects. And it's hard when, your body is going through massive blood loss and all the things that
There's a lot going on.
Through. And so we wanted to make sure to kind of rule it out. So we changed up her sedation meds from the one she was on when that was happening. And it seems to be happening less. Now that's also because her body in general is doing much better now than it was that night.
Yes.
But it was, so they ended up having to take her that CT scan and giving her some blood. And they found at that time that they needed to change her dialysis line placement. And so they took the one out of her leg that they had in there and moved it up to her neck.
So they made a new port there?
They just inserted a new dialysis catheter into the vein.
Okay.
Yeah. And so
so that's just because it wasn't a good vein there, or
it wasn't. It looks like it had actually been inserted into an artery, which is not where you want a dialysis catheter. It can cause some circulatory impairment if it's in an artery rather than a vein. And so we had the vascular surgery team come and evaluate her to make sure there wasn't any extensive damage, and it looks like she's okay. They did a CT of the area, and they had to do a little internal fixture of the artery.
Is that just because there's so much stuff there? Sometimes you might just hit the wrong thing, or?
Yeah, the vein and the artery actually run right next to each other. And I don't, when they inserted that line was when she had coded when her heart had stopped. And so someone was doing compressions, and someone was in there.
Probably real stressful.
It was very stressful and very difficult. And we try to take every precaution so that things don't get inserted into the wrong vessel. But I think just when your heart is not pumping, it's hard to tell the difference between an artery and a vein. Because usually you can tell when your heart is pumping because you see the blood flowing through your arteries with the heart pump.
Okay.
And unfortunately, hers wasn't at the time. And we don't know exactly.
Yeah, I mean, and that's things happen, you know.
Yeah, but
Sucks to happen,
as
but
soon as they caught it, they were able to fix it. And then when they gave her the blood and kind of were able to fix where a lot of her medications were going, they were able to get her off all the blood pressure medicines that she had been on to keep her blood pressure high enough. And so we now think that she's moving past the stage of like shock where like everything's just going on with her body, and we're slowly starting to kind of fit things together and get better kind of one piece at a time.
I see.
Her oxygen requirements have actually improved quite a bit. In fact, if she continues doing as well as she is, they're hoping to possibly extubate her tomorrow.
To remove the intubator?
To remove the breathing tube, yeah.
Okay.
Yeah, come on in. Sorry. Yeah, no. But that depends on a couple of things. We need to continue monitoring her today and then do a breathing test tomorrow morning and see if she's ready for that.
I see.
And then other than that, our big concern is when patients are in the kind of shock that she was in, sometimes different parts of your body can just shut down. And so one of the big ones that happens to is your digestive system. You know, when you're don't have the blood flow to your body that you can kind of have, your body takes it from the least important areas and sends it to the most important areas like your brain and your heart. And so sometimes a lot of times your gut gets a little bit of, gets the shaft just because the way your body tries to protect the most vital organs. And so we tried to start feeding her through the tube yesterday, and it looks like she's having some problems digesting. It could just be because we're still waiting for that gut to wake up a little bit. But we're just going to have to monitor that, and we're really trying to give her a lot of laxatives to have a bowel movement and get that
Okay.
working.
Well, hopefully all that can work okay, because, yeah, don't want to bag or anything like that, but yeah.
Yeah, I think we're hopeful that it will. Really the biggest improvement we've seen is in her lungs. The time on the ventilator has really helped to kind of open them up. And if we can get that done, then I think a lot of the other things will kind of fall into place, because right now, I told you we kind of measure progress by like how many organs were helping. So when she was at her worst, she was in heart failure. We were having to give her all those blood pressures to support her heart. Her lungs were failing. She was on the ventilator. Her kidneys are
Already bad.
Her, all these kinds of things. And right now we're not giving her any circulatory support, so her heart is doing it all on its own. We're almost to the place where we feel like her lungs can almost breathe on their own. She'll need, of course, her kidneys will never recover, but it's being easier to get those numbers where we want them. And so really now we're just waiting on kind of her liver and her gut and her brain, which is she's actually doing much better today. For the first time, she woke up and was able to answer my questions and tell me she didn't want things and follow commands. And we do have her on some medications, of course, to keep her as comfortable as we can while she's still going through all this. But yesterday, she wasn't able to do any of that for me. She was completely out of it. And today, we have her on medications to make her sleepy, but if you wake her up, she's able to wake up.
Yeah, I was talking to her a little bit at first, but she kind of started moving a little bit, and I didn't want to...
It may startle her, because again, some of the drugs we're giving her may make her a little bit confused. Again, that's mostly to keep her comfortable. But the fact that she's waking up, and like once she kind of gets over her first startled bit, able to kind of like, are you in pain? She'll shake her nose, do you want this? She'll like kind of answer yes and no. I don't think she'll probably remember this at all, and I don't think she knows now exactly what's going on. But the fact that she wakes up and can respond to is actually a very good neurological sign.
Yeah, I was talking to her a little bit after that, and she was kind of shaking her head a little bit and kind of moving her hand a little bit. So she's somewhat attentive.
Yeah, which is very good. That makes us again, very hopeful because yesterday she had me a little bit worried when she wouldn't wake up at all. And it was kind of like real stiff. We thought that might be seizure activities, but now it's not looking like she's having any seizures and that she'll wake up once we turn all the medication off. We're hoping.
So you think, does that have anything to do with her, the thing? Or is that just so much stuff going on at one time?
I don't know exactly. I'll have to let Dr. Vendrum kind of give you an update about that because I know he's been talking to the neurologists and they're kind of more experts. It didn't look like it had grown much from the last scan that she had, but I haven't talked directly to the neurologist to kind of speak to that.
I see.
Yeah, he'll be by. He's helping with a little bit of emergency down the hall, but I'll let him know that you're here. I just kind of wanted to say hi and kind of give you a brief update about where we were.
Well, thank you, and thank you for taking care and being here.
Yeah. I mean, it's almost nice being stuck here because a lot of times I leave when patients are at their worst and then I don't see them through the worst of it, and I feel like she's through the worst of it now.
Okay.
And we'll hopefully get through to the other side.
Yeah, and that's good. Like with something this severe, you know, well, your day, and I'm sure there's been a night nurse, right? Okay, so you're familiar with everything.
Yeah.
You know, when she's been in other ICUs, you know, it's just like constant turnover of nurses, which I understand, but since she's critically ill, you know, it's nice having people that are familiar with everything, and so.
Yeah. Well, we'll be around, and I'll ask Dr. Van Dremel to come in and give you an update too.
Are you here till 5? And he's here till 5 as well? Okay.
Yeah. So we'll be here for a little bit. But I'm glad she was waking up and kind of responding to you as well.
Yeah, she was nodding her head and moving her hand a little bit. I was actually trying to find her hand, so she, since she moved it.
Well, I don't know if you noticed this last time, but whenever anybody has this many machines, we always tie the hands down.
Oh.
Just in case she wakes up confused. There's just some soft little restraint. She can move a little bit, but not enough to where if she got confused, she could reach up and start pulling things out when we're not there.
I've seen them before, but yeah, not on her, but
Yeah. Which, you know, kind of sounds barbaric, but it's much safer that way.
Oh yeah, especially with that thing, you know, nobody would want that.
Yeah, she could do a lot of damage if she, you know, woke up when I was out of the room and just started pulling lines and tubes and stuff out. So that's our usual protocol, that as long as they're on like life-sustaining equipment like this, we just kind of, and mind-altering drugs, which she's on, kind of keep our hands just tied down enough to where she can't reach up.
I see.
And do that.
Yeah, I mean, it makes sense.
Yeah.
And if you could, is that being sucked from her, or is that blood, or what is all that?
Yeah, so this is the when she went into that clotting disorder, she started some of the sputum. This does go down to her lungs. It's not being sucked up all the time, but we go down there and suck up stuff from her lungs occasionally. And it started to look like there was a little bit of blood in there, and so that's why they did yesterday and did the bronch. They wanted to make sure there wasn't like a lot of diffuse bleeding in her lungs. And they ended up finding that there wasn't a lot of bleeding, but there was a little bit, which, again, when you're having that kind of bleeding disorder that she was having, can be, you know, blood just kind of leaks into places, but it's not like her lungs were filling with blood. So they did the bronch to find out the extent of the bleeding in the lungs, and it looked pretty minimal.
Okay.
She's still having a little bit of pink, bloody secretions, but not a lot is coming up. And so we're just going to wait for that to heal on its own. We don't think that that's a lot of damage in her lungs. It's just kind of residual blood that we're having to clear.
Okay.
Yeah.
And earlier you mentioned, you said you have tried to feed her through the tube. Is that just like some vitamins and protein, or what is that?
Yeah, it's the tube actually look like this, and it's a complete nutrition. It has all the protein and nutrients and vitamins. And usually we just feed it through. She has this tube going down her mouth to her stomach.
Oh, I see.
It's this one right here. And people can exist on that for a long time. Some people live their whole lives on tube feeds if they can't eat real food. But when we try to feed her, what we do is we kind of check occasionally and see how much is sitting in the stomach. Because if your body's not digesting, it can just build up until you throw it up, right? And so I checked this morning, and she had a large volume just kind of sitting in her stomach, not moving through her digestive tract. And so we decided to kind of give her a little bit of a break and try and give her some medications to help get things down. And then we'll probably try to restart those tube feeds this evening or tomorrow. And then hopefully when she's extubated, she'll be able to eat on her own. But
had she gone to the bathroom?
She has not.
Like at all since she's been in here?
Yeah, no urine, which is kind of expected, because she didn't make very much urine before, is my understanding.
When at the previous hospital?
Well, just in general, like she's usually when she's
because she's on a limited liquid diet. Yeah.
Yeah.
Yeah, I mean, probably not much, but they were actually wanting her to drink at the Cypress Hospital. They were wanting her to drink like 1,500 milliliters of water. So like 2 of those big jugs that they give you.
Yeah.
Where before, just like everyday life at the house, I don't even think she was allowed one of those.
Oh.
So something happened where they were wanting her to drink a lot more.
Just kind of they were trying to like figure out her fluid balance.
So as far as going to the bathroom, number 1 or 2 there, I should have asked, but I didn't.
Well, do you know if like in data, because she's been a dialysis patient for a while, and a lot of times when you're on dialysis, your body just, like you get all the fluid removed in dialysis and your body doesn't make urine.
Okay.
But some people do still make some urine. Did she make any at all, do you know?
Yeah, I mean, I didn't really ask her much, but there was times where I noticed that she would go to the bathroom.
Okay. Well, I think from the other hospital, they told us that, and I don't know if that was just there or before, that she wasn't making hardly any urine.
While she was at the hospital?
Well, that's
or just in general?
Or just in general.
I
So
see.
we didn't know if she was what we call a muric, a dialysis patient who doesn't make any urine, or if she was a dialysis patient who still made a little bit of urine.
Okay.
But so far here, it doesn't look like
I
she's
see.
peed at all.
Well, I know she was using the bathroom at the house, sometimes that I would notice. Whether it was number 1 or number 2, I really don't know.
Yeah. Well, we'll keep an eye out. Basically what dialysis does is it makes urine for you. It does all the things that your kidney does, and the urine gets taken out in the dialysis machine rather than your kidneys do it. So we're less concerned about the lack of urine as we are the lack of a bowel movement.
I see.
Because we're ready for her to have one of those.
Okay. And you said she did not do number 1 or number 2 since she's been here? Okay. So that'll be a big step if she's able to use the restroom.
If she's able to have the bowel movement, then that's really what we're looking for.
Okay.
Urine, we can, we'll see it if it happens, but because the dialysis machine is doing most of that for her, we're not as worried about it. But we don't have a machine that's like doing her digestion,
I see.
And so we're waiting for her to have the bowel movement.
Okay.
Yeah. The team is thinking that, and this is more a doctor question, but just kind of time frame wise, if everything goes well and they're able to take her off the breathing machine, extubate her tomorrow, then possibly 4 or 5 more days in the hospital to kind of get her stabilized at least. And then we'll see where she is then, at least like 4 or 5 days in ICU.
I see.
And then we'll see where she's ready to go then. That's if everything goes well and we're able to slowly take away all these machines.
I see. Okay.
Yeah.
Well, that would be great.
Yeah.
I know it's a while from now if she's able to get out, but since she had the thing in her groin and she's been in bed for almost 2 weeks now, it's gonna take her a while to like be able to get up and walk and move, and she's probably gonna be sore.
Yeah, they did, in anticipation of her hopefully being extubated tomorrow, they did put in for like physical therapy and occupational therapy to come by and start seeing her tomorrow and doing some exercises so she can start getting some of that strength back.
I got you.
Yeah.
And that'll be good for everything else too, right? If she's moving around, blood flow and all that, right?
Yeah, that would be real great. Now sometimes, you know, your body can't tolerate moving around that much. So our therapists are very good at knowing how far to push someone as they're recovering. And,
Baby steps.
Yeah.
All right. Yeah, that's definitely a lot to take in, but I know she's in good hands.
Okay, let me see if Dr. Van Dremel, he, you know, can give a little bit more detailed information than I can. Let me go see if he's available.
Okay, thank you.
Mhm.